Welcome, everyone, and thank you so much for joining us today. My name is Stephanie Paul, and I am the Executive Director for MyFace. I am pleased to welcome you to this web education program designed for families of children with craniofacial differences, caregivers, and healthcare providers. I would like to thank the Joseph Leroy and Ann C. Warner Fund and Neil Laston for funding this important program and acknowledge their appreciation for the critical need to provide educational programs like this one for families of children impacted by craniofacial differences. MyFace advocates for a holistic, comprehensive team approach to care through a wide range of programs that we fund, including support of the world-renowned MyFace Center for Craniofacial Care at NYU Langone Health in New York City, which serves as a gold standard for craniofacial care. In addition, MyFace provides important direct services such as access to individual and family support groups, topic-driven workshops, informational webinars, and networking opportunities, travel assistance, and housing for out-of-town families, as well as providing access to educational resources and raising public awareness. MyFace is here to bring together the craniofacial community and help transform the lives of adults and children living with facial differences. We believe everyone deserves the chance to thrive and live the best life possible. And now to our program. Our presenters today are Dr. Patricia Marek, pediatric psychologist at Children's Hospital of Wisconsin and assistant professor at the Medical College of Wisconsin in Milwaukee, Dr. Alexis Johns, pediatric psychologist at Children's Hospital Los Angeles and assistant professor of clinical pediatrics at the Keck School of Medicine, USC in Los Angeles, California, and Leanne McGee, pediatric psychologist at Children's Hospital of Philadelphia in Pennsylvania. After the presentation, we will open up the program from questions from our participants. As you think of our questions for our speakers, please enter the questions into the Ask a Question box on the left-hand side of the screen during the program. We encourage everyone to complete the evaluation after the program because your feedback is instrumental in helping us plan for future educational offerings, including webinars like this and other programs. You may view the materials for this program and a printable version of today's slides by clicking on the links under the Event Resources dropdown on the lower left-hand corner of your screen. It is now my pleasure to turn the presentation over to Dr. Marek.
Thank you, Stephanie. I know we're all three of us are excited to be here tonight and get the chance to speak to this group about some things that families and caregivers can do to support your children with craniofacial differences. Tonight, I'm going to be talking about some things that parents and caregivers can do at home to not only support their child's understanding of their craniofacial diagnosis with some discussion about how to prepare your child for surgery. We're also going to start by talking a little bit about some of the parenting challenges that have been presented by the COVID-19 pandemic, as well as how those interplay with caring for a child with a craniofacial diagnosis. And then we'll end with some general behavioral management strategies. That's something that we oftentimes are asked about. There's more information in the slides that I'll go over tonight, so I would encourage you to print out the slides and review them at your leisure. So I want to start tonight by talking a little bit about parenting during COVID. We know that COVID-19 has absolutely impacted children as much, if not more than a lot of adults. Children have experienced separation from their loved ones, especially of older generations. Their schools are closed. They're missing milestone events such as graduations or birthday celebrations. And we can see children react to that in a variety of ways. Children might do what we call externalizing, which is become more aggressive, struggle more with emotional highs and lows. They might do what we call more internalizing, which is becoming more isolated. Children of all ages can pick up on stress at home, and they might try to deflect some of the stress that their parents may be experiencing. And we know that when you overlay a craniofacial diagnosis on that, Some of you may have experienced surgeries being postponed. We know that medical appointments might look different. Your child might be used to seeing their favorite, friend in the waiting room or going to the playroom during an appointment, and some of those things might be changed during the pandemic. We also know that their therapies might be virtual and many, many other changes. The most important thing that you can do as a parent is listen to your child. Don't assume what their questions are. Ask them what they already know. Ask them what they've heard. Answer their questions honestly. Kids will pick up on if you're not telling them the truth. But make sure you're using developmentally appropriate language and not sharing too much with them. Be aware of news coverage. Sometimes we leave the news on in the background, and children have a hard time realizing that it's the same story being reported repeatedly, and they think every time they hear it, it's a news story. And maintain a routine, maintain physical activity as you can. All of those things we know can be helpful. It is absolutely important to continue disciplining your child and having behavioral expectations for your child during the pandemic. Instead of becoming more lax, what we would really encourage is that you increase the comfort behaviors. You increase hugs, you increase time together, those types of things. And make sure that you're taking care of yourself and that you're coping and modeling healthy coping for your child. I'll encourage you to take a little bit of a look at this slide on your own, but just knowing that transitioning, when we get there to more of the post-pandemic life, kids may have a harder time. If you think about percentage of life, more of their life percentage has occurred during this pandemic than ours has as grown-ups. And don't try to make up for everything that was missed. Think about what you want to continue. A lot of families have started some great traditions, whether it's game night or family FaceTimes or those types of things. So what does your child want to continue doing? I'm going to pivot a little bit now and talk for a couple of minutes about what you can do at home to build on your child's understanding of their craniofacial diagnosis. This slide and the next has a table breaking it down by age, and I would encourage you to find where your child is on this table and look over and see it and what you can do. We know that kids don't notice differences right away, and it's important to point out that kids notice differences before they assign value to differences. So a lot of times kids in preschool will point out, you wear glasses, I don't. You have straight hair, I have curly hair, those types of things, and there's no value judgment assigned to it. And as parents and adults, we can sometimes have a reaction to that kind of difference being noticed, but know that it might just be a difference being acknowledged before that value judgment is assigned. Looking ahead to the next slide, you can see there, later school age, adolescence, some of the things that you can do to really build your child's understanding. As kids get a little bit older, making sure you maintain those lines of communication, thanking them for talking with you about their feelings or about what's going on. All of those things can be really helpful. We receive a lot of questions on how to prepare your child for surgery, and it's important to remember that your child's experience of surgery is going to be different than yours as a parent or a caregiver. Information for your child should be given in a way that they'll understand. You really want to assess for any false thinking or magical thinking. We use words like you're going to be put to sleep or those types of things. So making sure they understand what's going to be happening, but also honestly. Don't say it's not going to hurt, because there will very likely be some pain, but you can say, if you hurt, these are the things we're going to do to help you. Please remember that children are always listening. I think a lot of times we might be on the phone with a friend or a family member and think our child is playing outside or in the playroom, and they're listening. So be aware of how you're talking about their upcoming surgery. If your hospital does it, and it might be virtual right now with the pandemic, but consider a pre-surgical tour. It's also important to remember that even if your child has had a variety of surgeries as a baby and an infant, they might not remember those surgeries, or they won't remember them if they were very young. So while it might kind of become a little bit of old hat to you about going to check in and going to the waiting room and how that works, your child might not remember it. Please remember to prepare siblings. Make sure they know that they'll be taken care of. Make sure they know that somebody will be taking them to their activities, taking them to their events, and try to keep a sibling schedule as typical as possible. It's okay to be nervous when your child's having surgery. Sometimes we tell our kids it's okay to be scared, but we try to be really tough. So stay relaxed, but normalize that this is a big deal. With the pandemic, we know that there's more uncertainty. Surgeries are being canceled or rescheduled. I've gotten the question a few times, since it's virtual school, do they just do school right away? Maybe even from the hospital? It's perfectly okay to take a few days. Even though you could go to virtual school, it's okay to take a few days to recover from a surgery. Visitor restrictions, if they're used to having their siblings come visit them in the hospital, that might be something that's different. And making sure they know that the hospital may look different. Like I said, child life activities might be different, or I know in our hospital, the therapy dogs weren't able to come for a while, and that was something that was really hard for a lot of kids that were used to doing these things or meeting with these people after their surgeries. There are absolutely things that you can do based on your child's developmental age to prepare them for surgery. We have this broken down here by age, but really I would encourage you to let your child guide you. Some kids want to talk about surgery. Some kids want to prepare for surgery. Don't want to think about it until the day that it's happening. So really let your child be your guide. And they'll tell you what they need, and they'll show you what they need in terms of getting ready for surgery. The last pivot I'll make to touch on the third point of this part of the presentation is general behavioral management. We could do a whole evening on this. So once again, I'd encourage you to review these slides, kind of thought through what are a few of the basic behavior management techniques that I would encourage, and really looking at what's triggering a behavior, what's the behavior, and what's the consequence of the behavior. Catching your child being good. We're really good at catching kids being bad. Don't do that. Stop doing that. But we know it's really important to also, thank you for playing nicely while I was on the phone, or I like how you helped clean up after your brother made a mess, or whatever it may be. And really ignoring negative behaviors whenever you can. If you have to for safety, absolutely pay attention to the negative behavior, but you can even kind of talk to the air, or really give as little attention as possible to the negative behaviors. We know consequences need to be consistent, immediate. The concept of wait until somebody else gets home is not going to be a good behavioral management technique. We want to talk about things like timeout. I have a couple of slides on timeout that you can review. We want to talk about, like I said, positive attentions for positive behaviors. And I think it's important to just say, as we're going through this, that with children with craniofacial diagnoses, having consistent behavioral expectations is just as important. We get a lot of questions about, well, how should I parent, or should I set the same limits? And the answer is absolutely you should. So all of these behavioral management techniques are effective for all children. Here's a great little table to just kind of look at things not to do and things to do. Know that we all, including us professionals, do the things in the do not column. It's really easy to talk about effective behavior management when you're not stressed. We know it's hard to do it when you are stressed. So take a look at this. Be kind to yourself if you realize that you're doing the things on the do not column. We all do them. And then, like I said, here's just a great way to review timeout. A lot of us do timeout. A lot of us do it in maybe the not most effective way. So sit down when you're calm, when you're not stressed, and kind of look through how to do timeout, how to take your child through timeout, what to do if they refuse. That's a common question we get. And then for older kids, really we're talking about different consequences. We're talking about removing privileges, those types of things. So that was, like I said, a very quick overview of some things that you can do in the home setting to support your child. And now I'm going to pass the presentation over to my colleague, Dr. Johns.
Thank you so much. So I am the psychologist in Los Angeles at CHLA, as you heard, and I'm going to be talking a little bit about social connections. So we all know that COVID has had a huge social impact on us. Logistically, masks have made communication a lot harder through muffled speech, taking away all the visual cues that we're used to, particularly if we have any hearing loss. And it has also highlighted in a new way how people may respond differently based on shifts in appearance and bring up questions about self-image in a new way because of the masking. Most of our daily life has also moved online and has centered on our faces with hyper focus on our facial appearance. Never before have we spent hour after hour, day after day for over a year looking at our faces and other people's faces and our reflections. It's created a whole new series of concerns, and particularly for people who do have a craniofacial diagnosis, it brings up questions about self-image. And at the same time, we have unprecedented levels of isolation. We have the loss of our daily social routines, increased loneliness, there's a significant increase in mental health concerns, and all of this is taking place while we're in this sort of flux of hopefully starting to transition a little bit out of the pandemic, but these concerns are continuing around self-image, as well as ongoing anxiety about the health status, particularly given at this moment the Delta variant. And it's hard to think about going back into social situations and those demands. As much as we're excited, it's also bringing up a lot of concerns. And the idea of being more self-conscious than before the pandemic, and the idea of not wearing a mask, because these were things that never had to really be thought of the same way previous to having masks all the time, and just all of those social demands that come back with being at school and other peer activities. So this cyber life that we've been living was already the primary activity for American children, with 5 to 11 hours a day on screens. And the big part of that is social media, which starts for about 2/3 of children by age 10, but only 1/3 of children say that they have any type of parental rules for their social media use. There are some guidelines that are helpful that the American Academy of Pediatrics has recommended. Not counting distance learning, of course, we would want to have a limit of screen time. They recommend under 2 hours a day, with no or very minimal under the age of 2. And some general guidelines like keeping devices out of bedrooms, being able to model the use that you would like to have, so not during mealtime, and trying to balance it out with other activities. And that's been a lot harder to do during COVID. Social media, of course, has lots of great benefits that have been highlighted during COVID. That has been one of the few ways to continue to receive social support, have that normalization of a peer group, have shared interests, self-expression, creativity, identity development. So there's many benefits to social media, but there is a risk for cyberbullying. And this is something that can take place in so many different forms of texting, comments, chats, web pages, during gaming. And it can be an unlimited audience and go viral, or it can be very specific to a sports team. It can be hard to know who is the real person that is posting this. It could be anonymous or misleading. It can happen at any time. It can go on forever. And it's hard to supervise and investigate. Prior to COVID, it was about 25 to 35% of the population, and it's had about a 70% increase since COVID. So it's something that's very prevalent. As we go back to school, we're also thinking about getting ready for what's going to happen in person. But the cyberbullying continues. And having the way that you talk about privacy and screen use openly as a family is very important, that they should have the same values as you would have in any other setting, and be very supportive if it does take place. Rather than thinking that this is not a big deal, it can have a huge impact, particularly when that's our only social recourse at the moment. And thinking together about how you want to respond. That may also include taking screenshots and gathering evidence, things like that you may find helpful. For a lot of things, you can directly contact the platform administrator to block accounts, take down content, delete things. You can also report it to cyberbullying.us. And if it continues to be an issue, you can also seek mental health support. The in-person version that is starting up as schools open reminds us that about 1/3 of children do have in the general population teasing or bullying take place, and that is higher for children that have a craniofacial diagnosis. And teasing starts generally in preschool, peaks around middle school, and declines by the end of high school. And if it's not addressed, it can have long-term outcomes for adults, and it can take place in multiple forms, as we've been talking about. In some of the research that's been published for populations with a cleft, there is a range of somewhere between 62 to 75% in different parts of the world. And in looking at research that comes for people who have microtia or craniofacial microsomia, it's sort of a little bit of a wider range, going from 37% to 85% in the UK. So as caregivers, one of the most important things that we were talking about just a few minutes ago is that attributing value to something that someone notices. So there is a lot of curiosity, comments, questions that are going to come up that have no negative intent, and having a child learn how to distinguish what is something that might be meant to be hurtful or is in a teasing vein versus just, hey, I see something different, I'm going to ask about it because I'm a kid and I have no filter. And so we'll talk a little bit about that in just a second, but just distinguishing that alone can be a really important skill to help at a very young age. And then checking in with your children about any sort of teasing in different ways. You may not say, hey, are you being teased? And they're going to say no, but saying, oh, did someone, make you feel uncomfortable, or do you feel like someone was hurting your feelings, or things like that. It might be different phrasing that you get different answers. And being able to balance wanting to jump in and be protective with letting children learn their own adapted independent coping, and how they can practice with you to respond to different situations, particularly at school, can be very helpful. If there are school-based concerns that your child is not able to just sort of take care of in the moment, be sure that you are then following up with the teachers and the administration rather than the other students or their parents. However, if it's within a family or friend network, then that's when you would want to collaborate with the family of the individual involved. And certainly if it's a physical aggression or a crime, then that's when law enforcement might be involved. Another thing that we can do as caregivers, as providers, is to be aware of the language we use. So without meaning to, lots of medical language has sort of this negative connotation baked into it, where we are saying abnormality, malformation, deformation, and it's not meant to be taken in any sort of way that's negative, but that's how the language is interpreted. So being able to use descriptive, neutral language with your child is really important for them, how they see themselves, and also how you can kind of cue your providers with, hey, this is what we like to say, so they can match the language you use. So for example, rather than saying birth defect, you can say a congenital diagnosis or something that a child is born with. Instead of saying that you're going to fix a lip, you're going to close the lip. Things like that they're very subtle, but they can have a lot of meaning, particularly when it's consistent. Another skill that can be really helpful is teaching how to be confident in our nonverbal communication. While we're virtual, our nonverbal communication is slightly different, but certainly in person, we send off so many messages without saying a word, just by how our body language is communicating our feelings. So being able to teach kids, even from a young age, to have positive self-talk, that they think about what they're great at, that they're proud of, that they feel really strong about, rather than thinking negative things that they're going to do horribly or someone doesn't like them. So having them really focus on what they are proud of, having a appropriate clear tone of voice, which it can be a little bit harder with masks, so it takes even more practice. Eye contact or camera contact, depending on the setting, the upright posture, and smiling without the masks. Even with the mask, if you smile, you can kind of see the change in people's expressions. So this acronym of STEPS is something for over 20 years we've been using with our kids here, and it's been really helpful. Another thing that's been great is to have that answer for those curious questions that we talked about a second ago. So someone says, hey, how come you talk like that? Or what's this here? Or how come you're going to speech? Or what's this hearing aid or what's this thing that you have on your head? Any of those types of questions, being able to label, reassure, and change the subject. So yeah, I was born with the top part of my lip was open. They closed it up. Hey, did you study for math? And just being able to have that very quick, confident answer usually takes care of the curiosity. And you can practice that with your kids so that they know how to say it as fast as their name, ideally, that it's just, they don't even have to think about it. Being able to be assertive is also very important. So using that confident body language for active ignoring and not showing through how they're slumping or looking down that they're being impacted by what's saying. Being able to walk away, saying no, using friendly humor versus sarcasm, which can escalate a situation, being around their friends for support. And when you have trusted people, that's when you can express feelings. I think a lot of times parents are like, oh, tell them, oh, don't say that, it hurts my feelings. And that's appropriate for a friend, a cousin, a sibling, but maybe not for the schoolyard bully, because they're going to be like, that's what I'm wanting to do, and they're getting what they want. So having them judge who are the people they can share their feelings with, and knowing in different settings who are the adults that they can get help from. Dating is another big part of social connections, and it's important to have open communication as a family about what your expectations are. And you might check in more about how a child's friends are thinking about dating. Someone may not want to say, hey, this is what I think, but they might say, oh, my best friend is seeing someone, and they're going to look and gauge your response based on how you respond to their friends versus what they might say about themselves. Talk about how they would bring up their diagnosis with a date and what they might do in different reactions or responses that they can be ready for. The research in this area, there's not a ton, but some of the research has shown that males at age 16 with a clef, for example, rate themselves as romantically appealing as their peers without a craniofacial diagnosis, with a very small difference for girls at that age. Another thing to keep in mind is maybe having an adolescent genetic consultation as part of your team visit. It seems that a lot of times there can be an assumption of 100% or 50-50 recurrence based on a very simple biology exercise that they did, and having the opportunity to realize what is actually specific to them can impact how they think about themselves as a partner, as a parent, as a future spouse. And how they think about that even as they're young and dating. It can be on their mind. So it's great to get that accurate information shared. Sexting is also part of today's social interactions. It starts fairly young and then becomes pretty common by age 18. Oftentimes our photos are being shared. And so it's important as a caregiver to know that child pornography laws can be applied to minors. However, arrests are much more rare if it's consensual and there has not been distribution of images. So something else to talk about with your child. There are many group interventions to target bullying or teasing. There's school-wide programs that you can connect your district with at stopbullying.gov. There's lots of training programs for social skills. There are specific support groups for children and family based on different diagnoses, as well as lots of great camp programs that hopefully post-COVID will resume in person and are happening virtually often currently. There are also lots of individual and family mental health services that can focus on coping, problem solving, dealing with anxiety and depression, building self-esteem, helping with advocacy if needed. And I think the big takeaway is, as family, you have the most powerful role in shaping your children's perceptions of themselves and their world. And even though there are these difficult social situations that come up, we see that most children learn to respond and cope positively without any long-term concerns. And all of the resiliency, empathy, and social maturity that they build because of these experiences at a younger age can serve them very well. And these areas of growth have really been highlighted, I think, during the COVID stressors in many areas. So I've also included some references that might be helpful, and I will turn over to Dr. McGee.
Thank you, Alessia. I'm Leanne McGee. I am the psychologist with the cleft and craniofacial programs at the Children's Hospital of Philadelphia. And tonight I'll be speaking a little bit about some of the building blocks for addressing our children's needs in the school setting. This is an area that has been particularly complex, I guess as all of it has been, in the past year and a half with the pandemic. And so your particular child's needs may vary widely, but also how schools are delivering education and educational services is highly variable. There is a lot of information on the slides, which I'll encourage you to review, and I'll just kind of fly through some of the most important aspects. Sorry, my slide controller isn't, there we go. So the needs that we can see in our patients with cleft and craniofacial conditions are highly variable. At the baseline, most of our kids are going to have absences from school due to medical, surgical, and orthodontic care. But a good number of our kids are also going to have needs related to their developmental status, speech and language difficulties, potentially needing occupational therapies, hearing therapies, vision supports. A good portion of our patients will experience challenges with areas of learning, executive functioning, and for some patients, developmental and behavioral concerns, including autism spectrum disorders. And for our kiddos with more complex medical needs, they may also require in-school nursing care or at-home education. What we understand about our kids with cleft and craniofacial conditions is that their cognitive and academic function variable are all an elevated risk for challenges in these domains related to the child's medical status. Issues in the school setting, though, are not just limited to cognitive functioning and should always be considerate of their broader medical, developmental, and independent functioning statuses. Within the school, there are laws that protect our kids' rights to free and appropriate public education. That means that every child with any kind of disability has a legal right to free and appropriate education. The services that are available to your child can vary highly depending on their state, the district, and the school setting, and the quality of the support services can vary. What I encourage my parents to work on is making sure that you're carefully and accurately assessing your child's unique needs when you're working with your school or considering school placement options for your child. Some questions that I think can be critically important to ask and to be discussing with your teachers and other educational support providers is making sure that you understand what type of school is your kid enrolled in, what is their classroom like, what are their strengths and challenges in the classroom. Have you noticed that there are particular activities that your child is struggling to do relative to their peers? Do they have an IEP or a 504 plan? We'll talk in a minute about what those are and knowing specifically what that includes and how the services are implemented. And the real critical piece is, are you as a parent happy with the quality and quantity of supports that your child is receiving at school so that they are maximizing their opportunities for education? When we identify that a child has needs in a particular domain or we have concerns that the child might, our next step is to pursue testing. Testing can run the gamut from very brief parent or teacher report forms to much more intensive, hours-long, multidisciplinary kind of assessments. For most of our kids who are experiencing challenges in school, what I recommend is a psychoeducational assessment or a school-based testing that looks at their academic functioning. That can include their achievement and grade level and help to identify some of the supports that they may need to access the learning environment. For children who have other types of conditions that are more complex, or if they have any neuroanatomical differences, more comprehensive neuropsychological evaluations may be indicated. These look at broad cognitive functioning, including memory, language, visual and perceptual skills, attention, memory, executive functioning, and how the child's medical status may influence their ability to learn and remember material. For children whose school performance is being affected by emotional or behavioral functioning, you may also be considering a psychological or psychiatric evaluation to determine if any behavioral, medication, or other types of emotional support needs are needed for your child in their classroom planning. The Individualized Education Program, or IEP, is one of the most frequently used educational support tools for our children identified learning needs. This is a legal protection. It's based out of the Individuals with Disabilities Education Act, IDEA, and it covers school-aged kids with one of 13 specified disabilities, which you can see at the bottom of the screen there. The disability must be determined to impact the child's educational performance and or their ability to learn or benefit from the general education curriculum, and therefore needs specialized instruction. So this is a child with an IEP, requires some sort of specialized accommodation in order to receive their educational instruction. IEPs have a very strict and formal legal process that must be followed at any school. The IEP team will ideally include the following members of the team at all meetings. This is highly variable, particularly with COVID. I think that has really challenged the creation and implementation of IEPs for many of our kids. The goal is that the child undergoes an evaluation. There is a determination of eligibility for services. There is the writing of the program, the meeting of the team to discuss the recommended supports and services. There is the signing off of that by all relevant parties, including parents. You're an important advocate for your child at this stage, implementing and then annually reviewing and reassessing the plan over time. The IEP should list very specific goals, benchmarks, and the services and personnel that the child will receive that school year. Now, on the other hand, we have some kids who have potentially learning or attention issues that don't need special education services or individualized instruction, but they may still need supports or services at school. They may qualify for something called a 504 plan. The 504 plan is developed to ensure that a child who has a disability identified under the law and is attending an elementary or a secondary educational institution, such as college, receives accommodations that allows them to access the learning environment. There is no standard 504 plan or program for implementing this, and so it doesn't have to be a written document. However, at most elementary and high schools, this is. This suggests but doesn't require a periodic evaluation, and sometimes can be as simple as having one of your medical providers write a letter saying that the student needs access to hearing accommodations, including the use of an FM system in the classroom. Now, there's often a lot of confusion about the differences between IEPs and 504 plans. I have some information on the following slides, and at the end of the slides, some websites that you can visit to learn some more, to kind of get into the lingo and figure out what's what. But in general, a 504 plan is considered less intensive in terms of what it requires in terms of individualized accommodations. It allows access to general education and the curriculum. It affects kids and learners of all ages, can include things like modified assignments, but the student is, because of that disability, not eligible for, does not need additional educational services. For a child with an IEP provides access to special education services. They must have one of those 13 designated disabilities that affects their ability to learn the curriculum. It's a very formalized process. It covers learners from 0 to 21, and that student is, because of their identified disability and associated learning needs, eligible for extra services. Here's from Special Mom Advocate. It's it's a really nice infographic that I think can help folks understand. Support services for kids at school can be highly variable. They can include push-in or pull-out learning support, sometimes a reduced or altered workload, extended test time. For many of our kids with cleft and craniofacial conditions, this can look like speech therapy, whether that's one-on-one or in a group setting, accommodations for hearing needs, visual accommodations, physical and occupational therapies to support kids with fine and gross motor skills, testing accommodations like extra test time, testing in a quiet room, access to the nurse's office, adaptive PE, and behavioral support, including something like a one-on-one or paraprofessional support, TSS and VSC services, and behavioral report cards or check-ins and counseling through the school. Just like we've learned in discussing medical and social needs for our kids, one of the most important things we can do is have open, honest, and age-appropriate conversations with our kids about what their needs are. One of the ways that we can help learn a little bit more from our kids about how things are going is just learning what was fun about school, what's hard. If your child's going to be scheduled for testing, make sure they understand what it is, that they don't have to study or prepare for it. We're just trying to figure out what they need to learn best, how their teachers and parents can do their job even better so that they can learn as much as they can and have fun at school. One of the most important things I think to emphasize is that we all have our own unique patterns of strengths and weaknesses when it comes to our skills and our learning, and that's the same for our kids. If your child wants to learn more about their medical condition, their accommodations, or their needs, it's important that you actually talk with them, maybe give them a chance, especially for our older students. Sometimes they are part of that IEP team, and so they can participate in those meetings. They can talk about what they feel they do and don't need in the classroom and be an advocate for themselves. The other key piece is learning from your student about whether or not they are receiving those services as implemented. Very often, it might be outlined in one particular way that they're supposed to meet with, the reading specialist 3 times a week, and you may find, oh, well, they're on leave and they haven't been meeting. It can sometimes be a long time before we realize kids aren't getting the services that they're encouraged to do. And kids can have a range of reactions. And so some are very engaged and want to be working on this. For other kids, there can be a little bit of a difficulty adjustment. You want to meet your child where they are and provide supports. When you request school testing, there is a formal process. We generally recommend writing a letter. There are some templates available online that can really help you with that process. You want to follow up on that. You want to find out what your state and local laws are in terms of the special education test process, and advocate and be persistent if an evaluation is denied and there is a need that you feel should be addressed in the academic setting. As parents, you are an advocate for your child. It's important that you're informed about your child's right to education, that you can ask the right questions to really understand what are their needs, what are the services, and what are the plans, and seek outside support as needed. That can be from community support organizations like MyFace. It can be from your cleft and craniofacial team, other parents who have navigated this process. And in some cases, it may mean working with a child advocate, a school advocate, to help you navigate that process. It's important that you're patient but persistent. We want to give it some time, but not too much time. The evaluation and implementation plans can take many months. For many kiddos, it can take a few years before we really figure out what their specific needs are. So for many of our families, this is a process that occurs over a period of months to years until we find that we are really honing in on that child's specific needs. And it's important that you are persistent. So make sure that you're checking in with your school about how the child's doing. Get your child's report as well. Make sure that those evaluations are being updated on an annual basis and that they're doing the full reassessment every 3 years if they have an IEP, and that we're not missing anything. As our kids grow and change, develop new abilities or maybe new medical needs, it's important that we're adaptive throughout the entire process. I've included some resources that have some really great information about educational and school-based needs for our kids, and encourage you to review those and follow up with your team providers, particularly your psychologists, social workers, speech pathologists, and nurse navigators who might be able to support you through this process. Wrap up with is that during this past year with COVID, learning has changed immensely. Kids are learning in new modalities. Teachers are teaching in new modalities. The availability of some of the support services has been limited. So it has really changed the learning process for our kiddos. Schools have had some time to navigate that. Ideally, they are still able to implement their services and adapt them. Many families are navigating the decision about whether or not to return to in-person schooling. That schooling sometimes is looking very different. And so just as Dr. Merrick and Dr. Johns reviewed, I think this whole process involves lots of careful communication with our patients, your team, your kids, your family, and your school to figure out what are the ways that we can best give our child access to the learning environment and help them really enjoy learning and thriving in the social and educational sphere. So I think what we're going to move on to next is hand it back to Stephanie to guide us through some of our Q&A.
Thank you, Dr. McGee, Dr. Merrick, and Dr. Johns. This is incredible information, just filled with so many nuggets of knowledge. Thank you for that. So yes, we're going to go to our Q&A, and before the operator gives the instructions on how to submit questions, I do want to remind everybody that we have many people on the phone, so we ask that you ask questions that are general in nature, and our speakers will answer those questions with answers that are general in nature. I'd ask the operator to give the instructions for our participants to ask questions now.
Thank you. Please type your question into the Ask a Question box that is located on the left-hand side of your computer screen. One moment, please, while we poll for questions. Thank you.
Okay, let's get started. The first question that we have is, how do you get your 10-year-old to participate in therapy even if they are resistant?
Oh boy, I can take a stab at that one, guys. You know, I think it's I think it really depends on maybe what some of the resistance is about. I would really partner with the therapist, and I don't know if you mean speech therapy or psychotherapy. I don't think it really matters what kind of therapy. I think partnering with the therapist to figure out what's going on. Talking with your child, not in an accusatory way, not in a lecturing way of you should do this or this is why you need to do this, but really sitting with them and seeing if you can figure out what's going on. I'm a big believer in non-face-to-face time to get information about your child. Go for a drive with them or cook or do something that's not sitting and looking at them, and they're probably going to be more likely to open up if you're not kind of inquiring them. If it's something that needs to be done, the conversation might be, we know that this isn't enjoyable, but it's something that you need to do for yourself and that we need to do. Let's talk through maybe a reward system or reinforcers or something like that. So I think figuring out more about what's going on and really partnering with the therapist to figure out how to increase that motivation.
Terrific, thank you. Another question, when a child is mean to your child and they turn other children against your child, how do you handle that?
I think I can talk about that a little bit. I think one of the most important things is to hopefully be able to always frame other people's behavior and what's going on in their lives. And if they're doing something like that, it's a reflection of them and who they are, and not a reflection of your child or what's going on with you. And always having that be the first foundation for any type of situation like that. Being able to hopefully then look for additional peer support in different settings so that there's a balance of positive experiences. And then depending on what's going on, particularly if that's at school, where they're going to have to be hopefully comfortable and want to be able to learn, being able to see what can be done directly with that situation. If it's something, sometimes it's very overt and something that the teachers can easily intervene with and work with those parents and have the school handle it. Sometimes can be something more subtle where it's more the teacher can't really see what's happening, or it's more exclusion versus saying things that the teacher can really immediately address in the moment. And so those are a little bit more challenging, and I think being able to have them really focus on what they do feel comfortable with and the peers that they are able to focus on, and a lot of active ignoring and working with the administration, or depending on what the setting is, who else you can pull in as a resource. And lots of balance of positive experiences would be important.
That's great. Thank you. Here's a question. My son is starting kindergarten this year. I'm really worried about how his classmates will respond to him. What should I do to prepare his teachers and his classmates? I've heard the parents going into the classroom and talking to the kids about their child's differences, or writing a letter to the classmates from the child. What do you recommend?
I'll take that one. I think it depends on partly what your child's interested in and what their age is. I think it can be really helpful for all students, regardless of their medical status, to have a chance to figure out what they want their teacher to know about their child. And so sometimes that can be, hey, Susie's starting first grade or kindergarten. He's a really eager student. He loves to read. He has a craniofacial condition, so he can look different, and maybe some of his speech can be hard for other kids to understand. Please let us know if you'd like to learn anything more about our student, and we're eager to meet you. I sometimes will recommend sending that letter or an email in contact to the teacher in advance, particularly if a child has very visible appearance differences that might garner some questions and that kind curiosity from other students. We want teachers to be prepared with how to answer and redirect conversation. If a child is going to have any unique medical accommodations in the classroom, maybe they have a G-tube, they have a nurse with them, or they might have speech that's difficult to understand, it can be really helpful to kind of do a getting to know you meeting with your teacher in advance of school. Whether or not you go into the classroom to talk about your child with the other classmates, I think that's a very family-specific decision, and I would really lean heavily on whether your child's comfortable with that, or if that's something they want you to do for them or with them. Very often just advocating and educating our teachers, they can navigate that as a part of their regular classroom curriculum about navigating social relationships, appropriate social behaviors in the classroom.
Terrific, thank you. Here's a question. We heard a little bit about this in the presentation, but I'll go ahead and ask it. My child had a couple of surgeries when he was younger, which he doesn't remember. He's now 5 years old and understands a lot more, so he's really scared about it. What 3 things can help him prepare for surgery?
Yeah, that's a great question. And I know I mentioned that a little bit in my talk, but I think, first and foremost, it sounds like you're realizing that this surgery is different for your child. It's the first one that they might be aware of. And so treating it as such, and, really making sure, using developmentally appropriate preparation, whether it's, watching a cartoon about surgery, or, playing with dolls, or doing a, child life pre-surgery tour. I know my hospital even has online, you can go online and there's some video tours of what happens when you come for a surgery. if your child wants to be involved in planning, what stuffed animal do you want to bring? What pajamas do you want to bring? What movie do you want to have to watch when we go home? Like I said, some kids want to be prepared. Some kids say, don't tell me until the day before. And you know what I want to bring, mom and dad, so just pack my bag, and I don't want to think about it. I don't want to have it on the calendar. So, knowing your child. This is also, I would say, a great time to work on some general emotional regulation skills. So when I feel scared, what do I do? Maybe I blow some bubbles, or I do some, relaxation breathing. I smell the flowers and blow out the candle, or whatever the imagery is. Those are great things for kids to learn, how to control our nerves when we're feeling nervous. They might have learned something in school already. A lot of schools are doing some really good emotional regulation, and I think we forget that those skills can be applied to surgical anxiety as well. So, doing some of that. We're going to do our big bubble breaths together in the parking lot before we go in for surgery or whatever it is, so that the child feels like they have some agency over their feelings. I think that was 3.
Yeah. Thank you. Dr. McGee, this is a little bit building on the question you just answered before, but I'm going to ask it because it's for a younger child. My son is starting preschool in September. Do you recommend educating his peers about his cleft this early?
I'm a big fan of taking the kids' leads. So sometimes we don't always have to get ahead of it. We can sort of wait until kids get there. As Dr. Johns talked about, kind of awareness of differences socially kind of evolves over time. And so in the preschool years, it's usually a very neutral noticing of differences. And so what you might want to do in terms of prepping your child is being able to say, what are you going to tell your friends is your favorite color, and who's your favorite superhero? And what would you say if someone asked about your Baja, what would you say? And so you can model some of that with our more verbal kids. But generally, we just want to make sure that they feel that they have the answers, or they know the adults in their lives who they can turn to for those answers if they don't quite understand yet. At 3 and the preschool setting, I think generally a lot of education doesn't go that far. Potentially as you get into the early elementary years, educating peers who have an increased awareness of others and health status and differences, you might get a little bit more mileage out of it at a slightly older age.
Great, thank you. Now going to the other end of the spectrum, here's a question. My child is leaving for college this year. She seems okay. I'm the one who's a nervous wreck because I worry about how people will react towards her facial difference. I don't want her to see how worried I am. What can I do, as you say, to model healthy coping myself?
Well, if your child is school age, she probably knows that you're worried and that you're nervous, and she knows your personality. And if you're a worrier, she knows that. So even just acknowledging it and saying, yep, I'm worried. Looking back at past experiences, other times where she entered new situations and was okay, and remembering. And, a cognitive strategy that I like to use a lot is, as much as you entertain the negative, so what if people react negatively? Just give equal time to the positive. What if they don't? What if she's welcomed in? What if she has great friends? Because both are equal possibilities at this point. We talk about it with younger kids, but making sure she knows how to answer those questions. She probably does, but sometimes if she's been with the same kids since kindergarten, just kind of saying, do you feel like you know these questions? What do you want to tell your friends about your history? Having that open line of communication, making sure you're taking care of yourself. I will say, children going away to college, I don't know if this is a first or a last or an only or where, but it triggers a lot of feelings in parents, and making sure that you are taking care of yourself and letting her fly and being that safe place for her to land if she needs it. And knowing that she probably will be okay, but you're there if she's not. And just like I said, just kind of acknowledge mom's worried, it happens, or dad's worried. I'm assuming it's mom. Sorry, your dad's worried, whoever it is worried. And your daughter probably knows that already.
Yeah, and it brings home the point that the journey is not just your childhood, it goes on through your entire life. And so it's important that, you learn at the beginning ways to cope. So thank you for that. Okay, here's a question. My husband and I have 2 children. Our youngest has had to spend a lot of time in the hospital due to his craniofacial condition. My oldest recently expressed how she wishes that we didn't spend so much time with him, and why can't we be like other families who do all kinds of stuff together? Any advice?
I'm happy to take that one. This is such a great question. And I think one of the things that we've really noted throughout this presentation is that kids don't live in a vacuum. They're nested in these different systems. And one of the most important systems is the family system. It can happen that the child who has the identified medical needs gets some more time and attention, and that can be very obvious to siblings. It can be so important from an early stage to be making sure that siblings are included, but also that they're getting some of their own time, special time with their parents. It can feel, I treated two kiddos, they're identical, well, not identical, they're twins. And the one had a very complex craniofacial condition and the other was unaffected. And she was so jealous of all her sister's surgeries. She had so much special treatment. She got to be on the news. How unfair is this? And it was a really difficult thing to navigate. We ended up working and doing some family therapy together. And it was a really interesting and effective way that they all each played an important part in that process. There was no single person who was at the center of the discussion, the center of the solution. It was a team effort by all family members. And so I think, if it's affecting your family functioning, certainly looking at family counseling can be a really effective strategy. If it's just starting to be like a little bit challenging, one relatively straightforward strategy is carving out special time with each kid in the family so that you kind of are working on the balance to have some time just between you and each of the kids on their own that generally can even out a little bit. Some hospitals also offer, here at Children's Hospital of Philadelphia, we have something called SIB shops. It's a support group just for kids, siblings of kids with chronic health conditions. And so your hospital may offer something like that as well, and can be a really special way for siblings to connect with other siblings.
That's great. Thank you. We have time for one more question. I think this is going to be for Dr. Johns. My child is on social media and was cyberbullied this past year. She had virtual schooling for the last year and now is supposed to go back to school. She's saying she doesn't want to go and wants to be homeschooled. Part of me wants to do that, but another part knows that she probably it's not doing the right thing for her. What do you recommend?
Yeah, I think it's so tricky. Even before COVID, there's always been, I think, this very natural wanting to protect your child from negative experiences that can happen at school, whether they're happening virtually or in person, and homeschooling as an alternative is something that can be very attractive for that reason, to think, okay, I can take out this negative part from my child's life and they're going to have a much happier day. And there are definitely some occasions where that may make sense. I think in general, though, we want to be able to have children have the same coping skills that they're going to need in the world that they learn as children, and being able to help cope and address with what's going on either online or in person is really going to be the more valuable and more long-term helpful thing as a parent to do. And it depends on the circumstances, if it's something that can be moderated by the school. If it was happening, for example, during the virtual school platform, then it's something that the school would be involved in. And oftentimes laws related to cyberbullying in many states are actually relying on schools to help address those issues, even when they're not directly related to the school if it's to students. So most often working with the school administration, who will have a lot of experience and resources to be able to help, is a good first step, as well as just giving lots of coping and support to the child so that they feel confident to go back to school and have lots of other wonderful social activities online or in person or in the family, depending on the safety concerns with COVID that are appropriate, so that school is just one part of a very full life and that they're given all of the tools to be able to go in and succeed there.
Wonderful. Well, thank you, Dr. Johns, Dr. Marek, Dr. McGee, for your incredible information and your time today. It was really wonderful. I do apologize we didn't get to all of the questions, but if you have any questions you would like to ask us, you can go ahead and send them to us at info@myface.org. Because craniofacial differences can impact the body and spirit so significantly, MyFace provides direct services such as access to patient and family support groups, all now virtual, topic-driven workshops, and online programs that serve to educate as well as entertain. These programs offer guidance, resources, and a supportive environment for all who participate. MyFace also hosts networking opportunities that seek to bring our community together, to empower the spirit and build strength and let families across the country know they are not alone. For information about the programs and services we offer, please visit myface.org. I also want to emphasize to everyone who has joined us today that we appreciate your feedback and comments and want to make sure that you complete the program evaluation form. We hope you enjoyed this program. Please look out in your email to register for our next Transforming Lives webinar series. Thank you for sharing your time with us and have a wonderful evening.